Tonight, members of the population living without homes. Who exactly are these homeless, and what do they mean for healthcare workers? I'm Stephanie Schultz, and this is Nursing News. Tonight's top story, the homeless. Some might say, sure, there's homeless out there in the good old USA, but not here in my backyard. Well, to those people I would say, you're wrong. StudentsAgainstHunger.org tell us that across the U.S., around 750,000 people are homeless each night. And according to the Sacramento County Homeless Count of 2011, on any given night, 2,358 people experience homelessness right here in the Sacramento area. Keep hope, as this is a 16% drop from the 2009 homeless count, and that drop has been attributed largely to the HPRP. In 2009, President Obama signed the American Recovery and Reinvestment Act, which included $1.5 billion for a homelessness prevention fund. And it's from this act that Sacramento saw the birth of the Homelessness Prevention and Rapid Rehousing Program, or the HPRP. HPRP's vision is to transform the homeless system from one organized around shelters to one centered on prevention and rapid return to housing stability. The HPRP's main goals are permanent housing and long-term stability by rapidly transitioning participants to long-term housing. Housing has occurred primarily by rehabilitating existing single-room occupancy hotels in downtown Sacramento and by developing affordable efficiency apartment housing for extremely low-income individuals throughout the city. Even though HPRP is showing a downward trend in the local homeless population, there are still nearly 2,400 people who are in need of assistance. To find out where these people can receive services, as well as what kind of resources are available to them, we turn now to our investigative reporter, Susanna, as she interviews our Community Research Coordinator, Amy.
Thank you, Stephanie. I'm interviewing Amy, the Community Research Coordinator. Hi, Amy. How are you doing?
Hello. I'm doing fine today. Thank you.
I just have a few questions regarding homeless services. Do the shelters have limitations on how long clients can receive assistance?
Some homeless shelters are time-specific. For example, St. John's Shelter Program for Women and Children is a 90-day program. We also have many churches in the Sacramento area that open their doors during the winter and provide a place for the homeless to stay overnight. They also feed them while offering clean clothes and hygiene supplies.
I know some shelters offer meals, but where else can they obtain food?
There are many places that offer food for the homeless or people in need. The food is donated from members within the community or members of a church and then provided to individuals in need. Some food banks buy food from donated money or receive funding from the county.
Where do resources for these services originate from?
Funding may be from the county or through grants from different foundations. Others, like church shelters, obtain their resources via donations and are run by volunteers.
If the homeless are in need of community or social services, are they available?
Absolutely. The Sacramento area has many resources specific for the homeless. Some of them help with housing, mental health services, alcoholism, or sobriety from drugs. Some of the different community resources have specific requirements to be eligible. For example, there is a program for one coming out of recovery. The maximum stay is 6 months, which allows time for the individual to get a job and save money in a clean and sober environment.
My last question, are there job placement services available?
Yes, we actually have a program called Sacramento Steps Forward, and their goal is to end homelessness and allow one to start fresh. On their website, there is a list of jobs that specifically work with homeless people to help one in need get employed. Some of them do have criteria like having a GED. Others just ask that you attend orientation.
Now back to you, Stephanie.
Great information, ladies. I'm especially excited to hear that there are job assistance programs, considering that when surveyed, 88% of homeless stated they wanted to work either full or part-time. Well, according to the 2007 point-in-time homeless street count, 74% of all homeless people have at least one disability, such as mental illness, alcohol and drug dependencies, or physical disabilities. For more information on the health problems the homeless population experience, We turn now to our in-hospital nurse reporter, Anessa.
I'm here at the Folsom Hospital, and we're here to address some of the common illnesses that homeless people face. Some of the most common illnesses are seizures, COPD, hypertension.
Oh my goodness. Your blood pressure is a little bit high. It's 280 over 180. I'm going to have to get the doctor, okay?
Diabetes, scabies and body lice, skin and foot problems, tuberculosis, stress, severe depression.
Hey Johnny, how you doing?
Not so hot.
They have your favorite ice cream in the cafeteria. You want to come with me?
Oh, cool.
What's wrong, buddy?
I'm not interested.
All right, sorry.
And mental illnesses.
Where am I? Dad? Dad? No. Who's over there?
HIV and STDs due to prostitution, multiple sex partners, low condom use, and needle drug use. And now back to you, Stephanie.
Now that we've seen some of the health issues the homeless are faced with, I'm interested to see what kind of experiences they have had with dealing with the healthcare system, especially with the providers themselves. For a more in-depth look into the opinions of the homeless, we turn now to our outside, on-scene correspondent Andrew as he reports to us from downtown Sacramento. Andrew?
Thank you, Stephanie. I'm here in downtown Sacramento, and today I'm going to be getting the thoughts from many different homeless people about healthcare workers. So let's start off by asking somebody about the subject. Excuse me, sir, is it okay if I ask you a quick question?
Yeah, sure.
What are your thoughts towards healthcare workers? Sorry about that.
Well, I don't respect them because they don't treat us like normal people. We're always discriminated against because we're homeless, you know, walking down the street. People laugh at us. They know you're homeless. Not wearing so normal clothes, dirty clothes, things like that.
I'm sorry to hear that, sir. Excuse me, ma'am. What are your thoughts on healthcare workers?
Oh, I get to the point where I don't know, really. I don't know or trust or like physicians. More and more, I see it as almost they would sooner deal with rich people, people with good insurance and everything else.
Okay, thank you for sharing. Excuse me, sir, what are your feelings towards healthcare workers?
You know, I feel like they just treat me like a piece of meat, you know, get me processed, get us in, get us out, and that's about it. I don't think they really care.
I'm sorry about that.
Hey, I'd like to answer that question.
All right, sure, why not?
I hate them. I feel very unwelcome. My first time in the hospital setting, I'm not going to get treated like that. I'm not going to go through that again. I'd rather sit on a park bench and die.
I'm sorry to hear that. How would you feel if you were more welcomed in a healthcare setting?
If you were more welcome, you'd feel better. It makes you feel better. It makes you want to get better. If you're not welcome, you don't want to get better. If they don't care, then why should I get better? Because they don't care, I don't care. I don't care if I get better or not.
All right, well, thank you for sharing that with us. So does anybody here have anything positive to say about healthcare workers?
Oh, yes, I do.
Would you like to share with us?
Oh, sure.
Okay, tell us.
Yeah, I love healthcare workers. My doctor makes me feel great. He talks one-on-one to me, to you. You know, he's at your level, you know. It doesn't matter whether you're above him or below him like me. You know, he talks to you at the same level.
I'm really glad to hear that positive experience. Thank you for sharing with us.
Yeah. A lot of people don't do that to us because, you know, we homeless, you know.
Thank Thank you. Alright, as you can see, Stephanie, the view of healthcare workers in the mind of the homeless person completely depend on their prior experiences. If healthcare workers want to take anything away from this, they should remember that homeless people are still people and they want to be treated like everyone else. If we treat homeless people unwelcomed in a hospital setting, whether it be by looking at them awkwardly or talking to them in a different tone, they may never want to show up to hospital again, even when their health is failing. Back to you, Stephanie.
Thank you, Andrew, for that hard-hitting, pavement-pounding, raw and real expose into how the homeless feel. I sense an IRE award in the making. The research crew here at Nursing News has made contact with our inside source at the Library of Congress and has uncovered this rare instructional video on how to interact with the homeless. Who is our source? We cannot reveal his name, but it suffices to say he's the President of the United States.
In researching the content of this presentation, we found that literature on communicating with homeless individuals is rather scarce. What we present here is information distilled from 6 articles on the topic of homelessness and healthcare. We divide the information into 3 general parts: themes of homeless life, general principles to consider when interacting with the homeless, and practical suggestions for implementing these principles. When interacting with a homeless patient, it is good to keep in mind where they may come from. Some of the more difficult aspects of homelessness include anxiety and depression, drugs and alcohol, severe rejection and abandonment, criticism and abuse, alienation, lack of safety, vulnerability and disempowerment, distrust of the system, stigmatization, lack of control, caution, and survival. With these in mind, consider the importance of these principles: tact, trust, respect, and the avoidance of assumptions. Now here are some practical suggestions for implementing these mentioned principles. Formation of a trusting relationship. Trust is critical to the provision of health care, but it can often be scarce on the streets. Nurses for patients of this population should especially strive to cultivate this in their relationship. The importance of space. The homeless person may put an exceptional value on their personal space. Before entering their space, communicate your intentions and recognize the importance of that space. Positive communication with body language. Though you may communicate one thing with your mouth, beware of what you say with your body language. Respect, encouragement, and empowerment. Living on the street wears on a person's self-esteem and self-efficacy. Communicating respect, encouragement, and empowerment can counter these negative messages. This is important, particularly when you're doing patient teaching and health promotion. Persuasion towards care with sensitivity to needs. Some individuals may be resigned to hopelessness and may not have an interest in recovery or health maintenance. In the context of a trusting relationship, the healthcare provider might need to gently persuade the individual in the direction of increased self-care and health recovery.
So informational. And now, a word from our sponsors.
Excuse me? I'm homeless, but I'd like to be seen for a outreach.
Actually, that's not true. Come over here, guys. I'm going to tell you a little bit more about it. So in a non-emergent care, how can we offer help for them? In case of a non-emergent situation, we can always address them to a free clinic available locally. Some of the clinics that are available is the Mercy Clinic, that's downtown, the primary care clinics, free healthcare clinics, free HIV and STD testing clinics. So to better address their needs, we can refer them to the clinic that they need. So they are free available clinics.
Coverage is available for the homeless that would allow them to receive treatment for chronic problems.
One program that is available for the homeless is SSI. If a homeless patient doesn't have SSI, we can refer them to Human and Health Services to determine qualification. There is also the Division of Mental Health that has been providing mental health services for homeless adults with serious and persistent mental illnesses since the 1980s.
Who qualifies for SSI?
SSI, also known as Supplemental Security Income, is a federal program that provides monthly payments to people who do not have much income or own many things. SSI is for elderly people as well as blind or disabled people of any age, including children.
What other forms of coverage are available for the homeless?
Medicare is our country's health insurance program for people aged 65 or older. Certain people younger than age 65 can qualify for Medicare as well. The program helps with the cost of health care, but it does not cover all medical expenses or the cost of most long-term care. Medicaid is a jointly funded federal state health insurance program for low-income and needy people. It covers children, the aged, blind, and or disabled, and other people who are eligible to receive federally assisted income maintenance payments.
Thanks, Susanna. Between SSI, Medicare, and Medi-Cal, I see now that there's a lot of access they have to health insurance. Now I know.
And knowing is half the battle.
G.I. Joe!
Even with progress being made to assist the housing needs of these families, it is important to remember that the homeless still comprise of a large group of our local population. It is almost guaranteed that each of us will have the opportunity to provide care to a member of this group. Today we used humor to bring attention to some of the issues the homeless face. Please do not take that to mean their struggles are lacking matter. As Andrew said earlier, these people are still people. Please remember that, and remember that the care you give and the way you treat them could mean a world's difference in how they heal and whether they choose to come back to the health care in the future or just rot away on a curb. I'm Stephanie Schultz, and this has been Nursing News.
Homeless, homeless, moonlight sleeping on a midnight lake. Homeless, homeless, moonlight sleeping on a midnight lake. Homeless, we are homeless, the moonlight sleeping on a midnight lake.